peoples. So this research is a systematic review of literature on about women in low middle income countries and how ultrasound imaging has transformed the culture of pregnancy management. I published this review with my master's supervisor, Dr. Zubia Mumtaz. So an obstetric ultrasound is a routine practice in pregnancy management. The Society of Obstetricians and Gynecologists recommends 2 scans during pregnancy, the first at 11 to 14 weeks and the second at 18 to 20 weeks. So these scans have many uses, including assessing gestational age, locating the placenta, and detecting any fetal anomalies. Many low and middle income countries are steadily incorporating obstetric ultrasounds into routine antenatal care practice. So for example, in India in 2016, through a national survey, 61% of women reported receiving an ultrasound during their last pregnancy. And similar findings from Syria came out where 98% of women received an ultrasound during their last routine pregnancy. There's a lot of like word jargon. Sometimes it's hard to say obstetric ultrasound so many times back to back, so forgive me. Okay, so the use of ultrasound scans for clinical management of pregnancy is essentially an introduction of a new technology in these contexts. So this is how I imagine it, a robot and ultrasound presenting it, because it is a new technology in these contexts. So starting point for technology uptake is its perceived usefulness. So potential users are more likely to adopt a technology if it serves a need, like a cell phone, for example, and then it's adopted into practice. So culture creates, so uptake of technology may also require cultural transformation. So culture creates the environment into which technology is integrated. So culture in this context being norms, beliefs, and practices. And moreover, there's reciprocity in this relationship due to the interdependent nature of technology and culture. So in some cases, the technology must adapt to the culture, while in others, the culture may respond to the technology changing forever in the process. And so there's a large body of literature that suggests that while pregnancy management is grounded in best practices for maternal and fetal health, it's also a culturally informed practice, including lay and medical cultures. The objective of the research is to summarize the literature on how the adoption of ultrasound technology in low middle income countries may have changed the contemporary culture and practices of pregnancy management as a whole. So for this research, I searched 5 major databases for primary literature. These search terms included ultrasound, pregnancy, and culture in various combinations, and periodic searches occurred to uptake the most recent literature. And so our inclusion criteria included an original study, peer-reviewed, and published in the year 2000 or later. And here's the PRISMA. Ultimately, 40 studies were selected for this. All of these studies were assessed for quality using the grade approach, and they were rated out of 50, so only high and medium quality, so 40, 50 out of 50, and 30 out of 50 were selected. And then this data was analyzed using Thomas Harding's thematic synthesis approach. All of this information is available in the full publication, like how we assess the criteria and specifics of each article. The first theme that emerged found that ultrasound scans are possibly replacing elements that currently constitute antenatal care, such as blood pressure measurements, urinalysis, and weight measurements. In a qualitative study from Vietnam, midwives reported an observation of pregnant women replacing routine antenatal care with repeated ultrasound scans. According to the midwives, some women were either ignoring or refusing to have any other antenatal care or diagnostic screening procedures other than an ultrasound. So consequently, a number of studies suggest that ultrasonography is common and in some cases the only antenatal care received by women in these contexts. So some doctors showed concern over the importance given to ultrasound and the resultant neglect of other elements in antenatal care. Another study found that upon the introduction of ultrasound, healthcare practitioners in Botswana were found not to take clinical examinations or do the recommended examinations and procedures. So the doctors in the same study acknowledged that ultrasound technology had started to replace their clinical examinations. The second theme that emerged found that mothers are overestimating the diagnostic abilities of ultrasound technology. So it does provide insight into why some women in these contexts were given greater priority to ultrasound over other elements of antenatal care. So a number of studies indicate that pregnant women believe ultrasound technology is the most accurate technology tool for assessing the well-being of their baby. So they believe it's far superior to abdominal palpitation and more importantly, superior to urinalysis and blood tests that are essential for diagnosing preeclampsia and anemia. In certain settings in Southeast Asia and Sub-Saharan Africa, at least some women believed in ultrasound guaranteed a safe pregnancy and delivery of the perfect baby. The third theme that emerged is that women are receiving an excessive number of scans that is possibly being driven by the commercialization of the technology. Surveys from Vietnam and Syria found that women were receiving an average of 6.6 and 5.5 scans respectively in otherwise normal pregnancies. In Syria, some women were receiving upwards of 20 scans in a normal pregnancy. So the literature describes how private sector clinics in some settings are pushing the growing commercialization of ultrasound scans and viewing it as an opportunity to increase revenue. The studies suggest that excessive number of scans were being driven by the private sector providers. So many studies showed physicians conducting a scan during each antenatal visit in an uncomplicated pregnancy. The final theme that emerged discusses inequity in access to obstetric scans. Studies from Rwanda and Tanzania discuss the shortage of usable obstetric scans, obstetric machines, primarily in public health facilities where these machines were either non-existent, limited, old, or in need of repair. So cost of an obstetric ultrasound was also seen as a barrier for women in rural areas. Midwives in Vietnam describe instances of pregnant women living in rural areas being unable to afford these scans as compared to their urban counterparts. And similar findings from Rwandan physicians observed that the costs of ultrasounds were barriers for women without private insurance. So in conclusion, the literature shows that women have been replacing routine antenatal examinations with ultrasound scans during pregnancy management, along with an overestimation of the technology's ability. These beliefs are being potentially perpetuated by the commercialization of ultrasound technology by healthcare providers in the private health sector ultimately. So this research has important implications for future research and practice. First, more research is needed to understand how ordinary prenatal care surveillance is becoming synonymous with ultrasound examinations. There's also a need to understand and address how to secure fair allocation of scarce obstetric expertise and resources to prevent overuse and misuse of the technology. Policies need to ensure that priority be given to practices known to be effective in maternal health care practice, maternal health, and not being driven by profit. And this is the full publication with references for more information. And thank you.